most of them actually don't know these symptoms could mean that they have PCOS. And it's such that it also doesn't manifest early, usually until maybe a late adolescent, reproductive age. That's when it tends to manifest. Or after the age of Rena, and most of them also don't know. Say these symptoms suggest say they have a condition called PCOS, so they should seek. So those are some of the lapses I'm into me identify. That's it.
What do you do?
Okay, so with that, we increase awareness just as we are doing today to make people get to know what this PCOS is. This condition, it's a genetic problem. Okay, so there is no identifiable cause saying A na abantina wenya B, but it tends to run in families' genes. But like we have for most other conditions, there's what we call risk factors. It's our risk factors, and we are able to solve these risk factors or address these risk factors, to help with some of the signs and symptoms, Okay, so to better put it, how we are able to address these issues. And I think I'll talk about some of the signs and symptoms.
Exactly.
Then how we go about to minimize the effect of this condition. So one of the first things, as I said, is the periods of oligomenorrhea, that they tend to miss periods a lot of times. Because you know, say by the end of the month, the signal is not coming. So for those period of months, they are not menstruating. So your banner or miss periods a lot. It's one of the things that should ring a bell. Okay, and then the other things I spoke about, so the facial hair, any acne. Okay, and also as a result of excess hormones. So those are some of the symptoms you may see. Some of the other things you tend to see in some of our patients, and also obesity. Most of them tend to put on a lot of weight. Yes, and also one of the symptoms are you need to raise. You need to come to us. Let us assess you for this condition. And for couples, I might try to conceive. I want to conceive a lot of infertility issues, And also could be one of the things I will experience here. You should raise a suspicion, say you could have polycystic ovarian syndrome to solve by all. Coupled with other things, most of them tend to have comorbid conditions. One including high cholesterol. Because of course, if you are putting on weight, most of them is going to be fat. Most of them also tend to have high blood pressure. Most of them are likelihood of suffering from type 2 diabetes. It's also type 2 diabetes symptoms maybe. Now with this facial hair, okay, some of those symptoms are polyuria, maybe a lot, polydipsia, succumbendo a lot, a lot. Okay, most of those symptoms related to diabetes, sometimes in the female of that reproductive age, all these symptoms, when you notice them, you should come to us so that we assess you for this condition.
Is it a regular routine for us as humans to sort of, in the space of maybe a month, 2 months, 3 months, to go check up on in Komoya Uboy?
Yeah, in an ideal setting, almost every 3 months to 6 months, nipa want not to me check up at because at any point in time, body know to touch him. So let me say, in advanced places, people or every family tend to have what we call a GP. A general practitioner, a family doctor affiliated to the family. So from time to time, the family is required to go for screenings near there, which will pick some of these things earlier in advanced places. Same cannot be said for us, but I think we are getting there. So once a while, you have to look at the financial aspect of our people and all that. So we do factor those things in. So once a while, within a 6 month period, you can screen for some of these things. It's helpful. So maybe you're able to pick them up before it gets worse.
Wow. Now, the treatment, is it expensive? I am sure the economic side of it. Because our people, the piano, almost Apomuden, but sometimes no more hair. Expenses one honey idea and I said or the we are no the wupreko.
The issue of money, of course, in our part of the world we cannot rule it out. It's a major factor that we consider in dealing with our patients. Okay, because sometimes even medications, there are brands of medication that some are expensive than others. So when we do factor in these things when we are dealing with our patients, it's such that, like I mentioned, there is not a definitive cure. Say when we give this medication, what we are in as a but based on the symptoms that the person has, we are able to help the patient. treating peacocks is not exceedingly expensive, and yet they are outrageous, honestly, because even something as simple as weight loss is a major factor when it comes to treating peacocks. Yes, because once you're able to lose weight, you know, say there are things that I think I mentioned earlier. I said most of them tend to be obese, weight a lot, and when there is excess fat and so on, one hormone that comes to play, which we've spoken about in our previous meetings, a friend insulin in diabetes people. So maybe I can say when there's a lot of fat, it resists the action of this insulin. Okay, so in people who are obese now, there's resistance to the function of that insulin. They need to lose weight. The insulin can function well. In the events where they are obese, the body is resistant to that insulin, so it reads as if it's not there at all. So it produces more. The more insulin you have in your body, it more of increases the level of androgen. Facial hair. Okay, there is even a hormone that's supposed to bind to some chemical or say binding to androgens. Now, my boss was saying, insulin prevents the production of androgen, so you have more free androgens in the body to worsen the case. So when you lose weight, as the body becomes more sensitive to insulin, you are a step further into treating the condition. So when we say weight loss, any money issue, and the other thing too, the other symptoms that we treat is based on facial hair, acne, there are creams and medications that we can recommend. Even with the acne, sometimes weight loss tends to help. But if the weight loss does not help, we go on to give some of these creams here. The other thing too we treat is the effect. Because the problem is the fact that the lady is not producing enough egg, or the stimulation for the egg production is not there because of insulin down. So also there are medications we can give to stimulate or produce egg at the point that is needed.
It will be the question be about very interesting. I'll say or not admit it. I'll say my question is a bit funny but serious. I've been told by doctors to conceive quickly. Unfortunately, I'm not married. How do I go about it? And she makes the point that over this condition, because as a more
and I mean, I guess where the person is coming from, because honestly, there's a problem with egg, the egg stimulation, and even naturally, or baby, as you age, the number of eggs it decreases. Okay. So with this condition, problem with bringing for the egg, and the natural occurrence, which is going to, of course, reduce the number of eggs as you age. There's a need that within, let's say, the young reproductive ages, you need to conceive as soon as possible, because then the chances of you ovulating or having more eggs are high. So if you have a boyfriend or somebody you are dating, I mean, it's our time getting married are complex. So if it be a so very expensive wedding be or something be a problem, abusu afọ tenase together. Be me ba we only way say e wo ho person tenase bu abusu afọ just one or two amako court ma sign with less than 2,000 while your wedding, or even less than 1,000.
Dr. Krabit me aboa.
No more sign paper, so that if you have to conceive as soon as possible.
That's his foundation. I mean, people that want to get married or Obana Shia Hona or no Din Koma.
Oh, very amazing. Look, now the line out to Hona. Oh, they are boy a team.
Everyone say, yeah, no. Said the doctor.
I'm going to be afraid you. Would be afraid here. All right, it's a doctor in nice sequence why have shape papa. The same person, so they are. Also, my minimum period days last for 7 days. I've experienced 3 weeks to 1 month. What do I do?
Of bleeding.
I say my minimum period days last for 7 days. I have experienced 3 weeks to 1 month. What do I do?
Okay, so with the peacocks, usually what they tend to have in most cases is where they don't have menses at all, so they tend to miss their period. But if it's such that you are bleeding more than usual, there are other conditions that could give you that, especially fibroids. It tends to be one common cause of excessive bleeding. It's so because when you are bleeding, Obana would not contract it to stop the bleed.
Okay.
In some way, but when you have a fibroid, it's able to contract also, you tend to bleed more. So, I don't know, you have to come back to us. We need to do it.
I think it's also
let's do a couple of things now.
Yeah. All right. And also, bet me afraid quickly now, doctor, for a new December, pick course and Kakrana doctor and Timmy, and ya no mamuna, young Fajumedi Nisi, because said them can kind. I am very busy this morning. Na on team in Concord to Nejuma so until wait my friend 0302 771593. What the message is in so bad said there onua de message say I ba ebetimi na ya kan na doctor so ya ne e dia amount no 0202115445 and now so say 0531971628 na ya kan e dia amount ya twen say in the next 5 minutes doc yani be wie na watimi akotoa na djuma so nto betimi afre na inti doc inti we know inti also and then this is what we are looking at inti the next time no you be called different area.
So yes, with the same condition there are other things we look out for. So there are certain things within the blood that different hormones that play a role when it comes to this condition.
Okay.
So we'll look at that aspect. Investigations how bad you pay the amount. And then like I said, there are a lot of other symptoms and conditions associated with this PCOX. And also symptoms treatment and so which mean your BP, which mean a high level of sugar. Okay, your free be obstructive sleep apnea, and also all of them are affiliated to this condition. So see all those aspects, how we deal with them when you have the condition. But the primary thing of focus is the fact that it affects the fertility. At least and they attach it the fertility better. Oba you will know a bit stimulate egg production. So they be able to produce to question also.
Okay, so there's a question here. I'll say, how do mood swings play a role in PCOX?
Okay, it's a very good question because there's psychological aspects or side to this condition as well. Yes, there's a social aspect to this because the natural way, cycle of everyone, we have chemicals within the body that regulate our hormones. I mean, that regulates how we feel. Sorry. There are certain chemicals called the hormones, they make us feel good. Some of them make us feel okay. These things are hormones within the body. So in this condition, there is balance, hormonal imbalance, so the natural way these hormones are supposed to work, they don't work that way. There is a bit of distortion to them. Normal time now, say some hormones will be produced, they are not produced, so it affects your mood and all that. The other thing too is that, of course, for every lady who wants to conceive, fertile, there's a social component to it, social tags near the stigma and all that. It tends to affect a lot of women who are going through this. So some of them become even depressed. It's there because, of course, it's there. Women too sometimes with the facial hair it tends to sort of disfigure them a bit. No baby, and so usually they want to look fine within the mirror near this. When some of these things, social isolation, so all these things affect your mood. So one from a biological point of view because of the hormonal imbalance.
Exactly.
And the other one from the facial, how I mean, you are concerned going to public places, maybe infertility, expression. So also all of them compound the mood swings and the mood problems they tend to have. It's a very good thing with this.
PCOX here, you home come now. Because I say, I mean, there are some creams or maybe tablets to be a bit in Yamanako. And on about the sana, PCOX, you're too as here, and because a facial, we can treat it on the outside and then focus later on the inside.
Yeah. So, as mentioned earlier, the focus of managing this condition is to deal with the symptoms because it's a genetic problem at large. In cure, we don't use the word cure, but you can treat some of these symptoms now.
Okay.
Because let's say you want to deal with the social aspect, maybe the confidence level, want to make people more and all that. Until you treat it, you'll be feeling good about it. So to deal with the mood aspect, so it doesn't cure the condition necessarily, but we're able to manage the symptoms. So the person feels comfortable.
There are a lot of messages seeking to have discussions with you, how do they go about it?
Okay, so maybe I'll leave my line with your platform.
Okay.
So they can get in touch with me on WhatsApp.
Okay.
Or once they get to you, I'm sure I'll get to know some of their concerns.
Okay.
So based on which one I feel I need to talk to one-on-one, we'll just go ahead.
All right.
And we can help.
Okay. Okay. And I have say. Doctor said them di kan no na de onia daje krakrakra bet ye dana se so say the touch don say the tibia no decide say we pass it through now near be this. So we'll have a part 2 of it. They said they was share bono probably next week or be say na ya part 2 of it, but you take the opportunity na yenda Excel natural clinic for us say o maso yasene na ye de apomuden komodi we e de bre mu Excel said ye kan o mo malam gba we kwantimpon so ujusu na obo mo promo a ombetimi na omako mboa or diabetes or fertility issues or cancer, bladder stone, kidney stone, cholesterol, impotence, hepatitis A, B, C, D, skin and eye problems. Say ya de bia ya so kranko bia no for come so ye na omonko mboa na bibia nso nya fine obetimi from 0536 520 897 and now 0536 542 509. Sanso na yeda Amalina Children's Saving for assese and they omajibre na omudu omuntuma so abo external natural clinic for the ano say yenhwe ne yemfa apomudin komodin fambremo obetimi ne Amalina for edinsa woso e was 0501672445 and now 0501672446 say ope enkwada eniama etu akoton na nso wenya bibi de abowata so bronya na ebe obetimi ne wakoho na onye akudinsa woso enso kra nso obetimi aton niama ni bi utire ofie obetimi oda niama ni online untimi nkoje omo abetimi de abre ofie na bibia nso aye kama edi ama obetimi follow omo social media handles ne so Facebook enano na Twitter and X any TikTok any Instagram so nyina ewa Amalina Children's Haven obetimi na follow omo ho bibia fa nkwada ho bia court chese ni empabo mmehye socks wo mo behye du wo mbennum bibia be ma akwada na gina brand na ono so hu say yes waba nipam ukọ Amalina Children's Haven obenye bi wo ho nti doc ye beda wase nim say wonni bre na ebrese mu no ye di nko nti doctor Emmanuel Amwako Eje ni nkomodi na de ba wo Kolebu Teaching Hospital and medical officer or ye basisia oni entena
Amalina Children's Haven ye I had no bad time be on but I turn a baniema your best share, your bed da, your the bed diagro, the Bamana Tumbo, then you never Amalina. Amalina will crown your menina, none of was so dear. Your 3 levels. Level 1, be Waha. Level 2, a quaranta dear name Papua. Level 3, wholesale, do a store now Pencorania. Fabi, Amalina shop a whole wager block factory. Afro for cry, a fena ye piano. Amalina Children's Haven. I know about a pebia tonne banema.